Today's topic is ECG, electrocardiogram. So, before we see about electrocardiogram, we should know the basic conductive system. Yes, of heart, SA node, AV node, bundle of S, Purkinje fibers comes under conductive system of the heart. So, when there is electrical impulses which travels in these areas, which are represented in our electrocardiogram. So the contraction of any muscle is associated with electrical changes, which is called depolarization, and these changes can be detected by electrolytes attached to the surface. So this idea was first given by William Einthoven, who is called the father of ECG. He actually transferred a galvanometer to a ECG machine. Okay, so this is the old ECG machine. I know that you cannot imagine now, it's a very small size, like a laptop, the ECG machines are. But this is the very old first ECG machines given by Einthovens. So, who is the father of ECG is William Einthoven. So, what is ECG? The definition of ECG, it's a graphic record of the electrical impulses that are generated by depolarization and repolarization of the myocardium or myocardium cells. Okay, so graphical representation of electrical impulses generated by the heart muscle, we say it as ECG, electrocardiogram or electrocardiography. So what are the indications? So all the cardiac disorders, we can use ECG as a diagnostic method or diagnostic tool, a very important diagnostic tool. But in all cardiac, among cardiac diseases, coronary artery disease, where you can identify whether the coronary artery has any block, angina pectoris, myocardial infarction, cardiac dysrhythmia. So when there is abnormal heart rhythm, you can identify it through the electrocardiogram. Cardiac enlargement also, the ECG will show some significant changes. Electrolyte imbalances, especially the potassium depletion, magnesium depletion, calcium depletions, these all will cause ECG changes, that is arrhythmias, which are been noted in the ECG. Inflammatory heart diseases like endocarditis or pericarditis also give some changes in the electrocardiogram, and the effects of drugs on heart also causes arrhythmias. Okay, so these are all the indications for electrocardiography, but any cardiac disorder we can use ECG as a diagnostic tool. Next we'll move on to ECG machine. You all know, you have seen ECG machines of different companies. Here this one I want to show you, so that I want to show you all the parts of the ECG. Okay, it is what is ECG machine? It is a galvanometer and electrodes with 6 limb plates and 6 chest leads recorded on a graph paper. So electrodes are 4 limb plates, not 6, 4 limb plates and 6 chest leads. Okay, and these is recorded on a graphical paper. So ECG machine is a galvanometer with electrodes. So this is an ECG machine, and these are the 4 limb plates, and these are all the chest leads, 6 chest leads, electrode ECG paper, okay, and the plug point, and here are the bulbs which are used in the chest. Okay, so these are all the parts of an ECG machine. There will be 4 limb leads and 6 chest lead wires here also, and there are bulbs which are used, and of course we need a gel to do the ECG. Okay, next is ECG paper. So when you see an ECG machine, ECG graphical papers, there are small squares and big squares. Yes, each small square is 1 mm of size, that is 0.04 seconds. Okay, and each big square is of 5 mm of size and 0.20 seconds. Okay, this is very essential when you calculate the PR intervals and other intervals. These squares are very important. Okay, small square represents 0.04 second and big square represents 0.20 seconds. If you see the ECG pattern, basic ECG pattern, there is an isometric line. This is called isometric line, and the waves go up and down on the isometric line. So if it goes up, we say it as positive deflection, that is positive deflection is above the baseline, and there is negative deflection like the Q wave, S wave, which are called negative deflection. The next is leads. Leads and lead wires are different. Lead wires, this is a lead wire. Okay, there are 6 chest leads and 4 limb leads, as I have seen. So we have lead wires 10, but we have 12 lead in total, that is bipolar limb leads, lead 1, lead 2, lead 3, and unipolar augmented leads AVR, AVL and AVF, and chest leads V1 to V6. I will show you here how these leads are formed, because we are connecting 1, 2, 3, 4 lead wires and 6 chest leads. So you will be saying that it's a 10 lead. No, actually we are getting an 12 lead from this 4 limb leads. So right arm, left arm and left leg makes an triangle which is called Einthoven's triangle. So this is represented by lead 1, lead 2, lead 3, ABR, AVL and AVF. Okay, lead 1, 2, 3 and ABR, AVL and AVF. So we have 6 here and 6 chest leads. Next we will move on to leads positioning. So how you position the leads? I hope you would have studied in the first. So how will you position the leads? Limb leads are positioned like this. The white wire, there are 4 colors which represents white or yellow, sometimes red, black, red and green. So sometimes it differs it depends upon the company. Right arm, right leg and left leg. If they don't have leg, you can connect it here. Okay. And the next one is chest leads positioning. So there are V1 to V6, 6 chest leads. The V1 is placed in the, so everything comes in 4th and 5th intercostal space. Okay. So the V1 is connected in the 4th intercostal space, right sternal border. This is the sternum and the sternal border. V2 comes under 4th intercostal space, left sternal border. V3 between V4 and V2. V4 is placed in the 5th intercostal space. See, 1, 2, 3, 4, 5. 5th intercostal space, mid clavicular a line, left side. V5 is anterior axillary line and V6 is mid axillary line. Okay, if you draw an imaginary line in the axillary area like anterior, mid axillary and posterior axillary line. So in the anterior axillary line V5 will come and mid axillary line V6 will come. Everything comes under the 5th intercostal space. Okay, this one is also 5th intercostal space. Here I have made a mistake here. Okay, this is also 5th intercostal space. So V1 4th intercostal space, left sternal border. Right sternal border. V2 4th intercostal space, left sternal border. V3 between V2 and V4. V4 is 5th intercostal space, mid clavicular, anterior axillary and mid axillary. So all these 3 leads comes under the 5th intercostal space. So what is, if we have a normal ECG, if you take a normal ECG, P wave, QRS complex, we say this QRS as a complex and there is a T wave. Okay, the P wave represents the atrial contraction, QRS represents ventricular depolarization, T wave represents ventricular repolarization, both atrium and ventricle, right and left, usually a positive. Okay, so there are few segments here you can see, but very important segments are PR interval and QT segment, PR segment and QT segment. So I just want to tell you what is the interval and what is the segment. So there are ST segment and PR segment. Okay, ST segment normally not elevated. This is an important area where in myocardial infarction there will be an ST elevation. Okay, this ST segment will show some elevation that is above the isometric line, which indicates myocardial infarction. So this is an important area where you should focus on when you read a ECG. PR interval, this is from the starting of the P wave till the starting of the Q wave. We say it as PR interval. So what happens here? It is normal is 0.12 to 0.20. You know what is 0.20? That is one big box. Yes, in the ECG paper. Okay, so 0.20 second is the normal time taken. But if it takes more than 0.20 seconds, it comes under first degree heart block where the conduction delay happens. So you will be studying in the third year about the heart blocks. Okay, so PR interval is an important aspect where you should focus because you can identify the heart block, first degree heart block. So 0.20 seconds. QT interval, not very thing, but there is delay in depolarization and repolarization. We can identify by QT interval, that is 0.36 to 0.45 seconds. So these are all the measurements you should remember. ST segment normally not elevated. If it is elevated or depressed, there are some problems. Elevation especially noted in myocardial infarction. Okay, T wave is usually positive. PR interval is 0.12 to 0.20 and QT intervals is 0.36 to 0.45 seconds. Heart rate can be calculated by looking at it. Sometimes if it is a normal rhythm, you can look at the ECG strip, that is 6 seconds ECG strip, and you can calculate the heart rate. So it is calculated by 1500 divided by number of small squares in 1 RR interval. In this RR interval, you can calculate how many small squares divided by 1500 divided by how many small squares, or you can go for 300 divided by number of big squares. See here, number of big square is 1, 2, 3, 4. First you have to see RR interval is regular or not. If it is regular, you can calculate heart rate. So how will you calculate? 1, 2, 3, 4. 4 big boxes. So 300 divided by 4 is equal to 75 is the heart rate. Clear? You can calculate the number of small boxes also. 1500 divided by small box. Nurse's responsibilities. What is your role when you do an ECG? No preparation needed for the patient, but you should explain the procedure, reassure the patient, and provide comfortable position and provide privacy. Okay, nurses must be able to detect abnormal rhythm. When you do an ECG, you are responsible for noticing changes in the ECG. If not, you should show it to the senior nurses or to the doctors. Abnormal rhythms are recorded and reported immediately. If you are in a cardiac ward and you are monitoring the rhythms, you have to note the abnormal rhythms and record it immediately and report it immediately. Ensure good contact between skin and electrodes by applying gel. You have to apply a gel, but it should not be too much less or too much too. It should not be less. It should not be more. Client should lie flat and relaxed and avoid any movements. So you should instruct the client not to move around and relax, not to to avoid any movements. Bystanders should be kept away from the patients. Usually it's better to keep them away. Lead should not come in contact with ornaments or gadgets. Don't tell them to remove the ornaments and all, because ECG is a very basic procedure, but you can tell them not to touch ornaments or gadgets. Gadgets better to be moved out. Machine should be checked for proper condition before bringing it to the patient's bedside. Machine should be properly grounded. Nurse should ensure proper placements of leads. No other electrical equipment should work during the procedure. So once your procedure is done, you should wipe off the gel and you should make the patient comfort, help him in dressing himself, and make sure that you are replacing the equipments properly. So in this class we have seen what is ECG, history of ECG, and indications of ECG, definition, indication, ECG machine, what is the ECG paper and what is the size, ECG pattern, what are the different types of leads. There are 12 leads in an ECG. Don't look at these lead wires. Lead wires are different from leads. Leads are imaginary things. Okay, so here you can find it out with this Einthoven's triangle. So lead 1, lead 2, lead 3, and AVR, AVL, AVF, and then there are 6 chest leads. So what are the lymph leads? How is the color code and how will you position it? It's given in this picture. Leads, positioning of the chest leads. Okay, and what is normal ECG? What are all the intervals, PR and QT interval, time taken? In the ST segment, usually it is a straight line, but it will be elevated in or depressed in case of myocardial infarction. T wave is usually positively deflected. And how to calculate the heart rate? 1500 by small numbers or 300 divided by big squares, big size. Okay, and what is the nurse's role? Okay, so the main thing is when you do an ECG, you should properly label with date, time, and the patient's identification and put it in the proper file. And before filing it, you should make sure that someone has seen the ECG, either the senior nurse or to the doctor. Okay, to make out is there any changes in the ECG. This is a very important practical aspect you should remember. Just don't do as like a machine, just put it in your file. Okay, so you should make sure that the changes have been noted by the doctors. Okay, thank you.